Hello, everyone. This is tonight's episode of Navigator Nuggets. I am your host, Dr. Nicole Rochester, founder and CEO of Your GPS Doc. Thank you to all of you who are catching this live. Thanks in advance to those of you who will catch this on the replay. To my regular viewers, you may be a little confused, like what's going on. I did put up a post, but I know Facebook doesn't show a lot of posts, so many of you probably didn't see it. I do apologize. We did have to reschedule Navigator Nuggets to tonight. So, our regular day is Monday nights, every Monday night at 8 o'clock p.m. Eastern Standard Time, right here on the Your GPS Doc Facebook page. But there was a lot of drama, you guys, yesterday here in Maryland. Our governor finally did a stay-in-place order. Many of us had already been doing that. And so it just caused a lot of mayhem, and I had to deal with family and some personal issues. So I had to reschedule to today. So thank you to all of you who are catching this rescheduled edition of Navigator Nuggets. And let me just briefly introduce myself to those of you who may be new. Hi, Tiara. Thanks for joining. Hi, Tyrena. Thanks for joining. Let me know that you guys are here. Type a hello in the comments. To those of you who may be watching this for the first time, this is Navigator Nuggets. It's a weekly Facebook Live show that I do really to help educate and empower patients and their family caregivers. And my name is Dr. Nicole Rochester. I am a board-certified pediatrician by training. I'm a former caregiver to my dad, and I am now the CEO of Your GPS Doc, which is an independent health advocacy company. So I help primarily family caregivers navigate the healthcare system for their loved ones. Hi, Adrian. Thanks for tuning in. So you all, in full transparency, and you probably can see it on my face, I'm tired, y'all. I am tired, and I'm not even on the front lines. When I say I'm tired, I'm like emotionally drained, and I'm sure that many of you can relate. And I'm also tired of talking about coronavirus, but this is the situation that we are in. And, it's very, very important that I bring up-to-date information to you all that, again, will help educate and empower you, to help you take better care of yourselves and your loved ones. And so every week, for the last couple of weeks, I think, okay, should I talk about something else? But it would just be crazy to talk about anything else. A, I don't know that you all will even be interested in hearing about anything else. And B, I feel like it would almost be a little irresponsible on my part if I don't continue to provide updates. And I know that all of you have access to, CNN and MSNBC and your local TV stations and radio and the internet. And so, a lot of what I'm sharing may not be like groundbreaking news, but I always try to throw in some tips and inside information to really help you get through this as best as you can. And of course, we're all just doing our absolute best. But I just needed to say that because, part of me, before I hit live, I'm like, oh my gosh, I'm talking about coronavirus again. But it is what it is. So let me start by saying that I sincerely hope that all of you and your families are safe, that you are well. Unless you've been under a rock, you know that this pandemic has continued to worsen here in the United States and abroad. So I pray regularly for all of you and for all of us. So please know that. All right, so let's go ahead and get started. So let's see. I like to start with some of the updated statistics. So I will share that in just a moment. Give me 1 second. So let me give you some of the updated statistics for coronavirus. So this is as of 7 o'clock p.m. Eastern Standard Time today, which is Tuesday, March 31st. I cannot believe that the month of March is almost over. So globally, as of 7 p.m. Eastern Standard Time today, 855,007 cases and 42,032 deaths. So, that's just horrible. In the United States, 182,265 cases, 3,810 deaths. And you all, I remember on March 2nd, when I started this, I think we had 6 deaths. So, I just can't even imagine. So 3,810 deaths. And you probably have seen this on the news today that today there were 770 plus, because this number is probably still rising, deaths reported in the U.S. in one day. And that's the highest death rate that we've had in one day thus far. The good news, there's 6,910 people that have recovered in the United States. We are starting to get that data. And we do know that, from what we're being told, the majority of individuals who contract COVID-19 do recover. But of course, what you're going to see on the news are the bad outcomes. And I think that is important because, as you've also seen on the news, people are not following directions, which is why many governors, like my own governor here in Maryland, have had to institute, stricter and stricter guidelines because people are just not taking this seriously. And I honestly can't imagine how you could not be taking this seriously. I know that as a physician, while I'm not on the front lines, I'm mostly non-clinical. I'm in close contact with friends and colleagues who are on the front lines. And so I'm hearing the stories, but you guys are hearing them too on the news. And so it really angers me when I see pictures of people having, gatherings and parties and on the beach and just craziness, going to see the cherry blossoms in DC. So anyway, hashtag stay home, please. Okay. Maybe we shouldn't even say please, just hashtag stay home. All right. So that is the data. So a couple of other updates. So as you all know, what we're in all of the countries, really, we're at the mitigation phase, efforts to prevent the virus were, just futile. And so now we're really at the point where we're trying to flatten that curve, which really talks about, decreasing the spread, decreasing the number of new infections, because as you all know, we are really, really, really taxing an already broken healthcare system that was not prepared to deal with a pandemic of this magnitude. And so the more that you stay home, the better your chances of getting appropriate care or your family member getting appropriate care if, God forbid, you are infected. Many hospitals are running out of PPE, which is personal protective equipment, the N95 mask, even the regular surgical mask, gowns, gloves, things that they absolutely need. And I can't tell you all how many stories I've heard of from fellow doctors who are doing the unimaginable. They are getting one mask for an entire day. Some of them are getting one mask for a week. These are in outpatient settings. Hospital staff are getting like a kit, some of them, for the whole day. This is unimaginable. We do not typically wear the same PPE from patient to patient to patient to patient. I can tell you as a pediatrician, when we are in flu season and RSV season, the trash cans are overflowing all winter because every patient is infectious. And so, normally we're putting on a mask and a gown and gloves, and we're going into the room. And as soon as we finish with that patient, we're taking all of that off and going to the next patient and doing the same thing. So to hear and to see that my colleagues are out here having to reuse masks and gowns, and it's not gloves, thank God, but these are not ideal conditions. So again, the ventilators are in tight supply, and they think that we are going to be in a situation where we're going to have to ration care, something that has, I don't think, ever been done, at least not in my lifetime, in the United States. So I cannot stress enough how serious this is, and each of us can do our part by staying home. Only go out for essential reasons, okay? So, couple of things. Dr. Falchi, who is my boo, so is Governor Cuomo. They're my boo. Sorry to my husband, but they are my new boos. But Dr. Anthony Falchi, an infectious disease specialist and an advisor to President Trump, he said a few things today. He said that, they showed the curve for Italy, which, as you all know, was really heavily hit a couple of weeks ago. And we're finally starting to see that curve start to take a downturn in Italy. And that's after 4 weeks of mitigation efforts, meaning 4 weeks of strict social distancing. And, they started doing it earlier than we did and with much more strict enforcement. And so, but that shows a little bit of hope that, with social distancing or physical distancing, as many of us like to say, you can make an impact. Dr. Falchi also indicated that there's some very, very early signs in the U.S. that social distancing / physical distancing is having an impact. But he really wanted to, caution us that by no means indicates that it's time to relax what we are doing, because it is going to continue to get worse. In fact, on today's news conference from the White House, they said that probably in about 2 weeks is when we're going to reach our peak in the U.S. So please keep doing what you're doing. Keep staying home. Really, really important. Another update for today is that they're now revisiting this recommendation about masks. So you all know, for those of you that have been watching Navigator Nuggets, for the first couple of episodes in March, at that time, the CDC was very firmly saying that no one unless you're sick, you really should not be wearing a mask. And just so you know, the CDC is still standing by that recommendation. But others in the medical community are starting to rethink that, mainly because of the degree of community spread. So let me just briefly address that for those of you who may be confused, because they're even saying, these homemade cloth masks, they do not want us going out and getting N95 masks. And I don't even know where you would get it, because my doctor friends can't even find them. But they don't want that. And they really don't want us going out and purchasing all the surgical masks either, because we need to reserve those for the healthcare professionals who are on the front lines, literally fighting this war against coronavirus. But they are starting to rethink that recommendation about not wearing masks. And what they are saying is that while these homemade masks and things like that, or even a bandana or your scarf, while those things really are not adequate to protect you against the virus, meaning those viral particles, if somebody were to sneeze or cough right in your face, that is not going to really adequately filter those droplets. But what they're saying is that because we know that so many people who are transmitting coronavirus are themselves asymptomatic, meaning they're not even having symptoms, the thought is that if everybody starts wearing a mask in public, that if you happen to be asymptomatic, or if you were crazy enough to go out and you were sick, then it will just provide some level of protection from your droplets spreading, so that what is floating around in the grocery stores and things like that, pharmacies, will be minimized. So that's the rationale behind these kind of, I'm not going to call them recommendations yet, because no healthcare agency, CDC, the WHO, none of them have come out and formally said that they are recommending it. But some health professionals are starting to, say that. And Dr. Falchi even said today, yeah, that's probably not a bad idea. So I wanted to clarify that, because I know there's been a lot of confusion about the mask. All right. So now I want to shift gears and really address family caregivers. I had an amazing complimentary Q&A session on, what day did I have that on? I think it was Friday. And it was wonderful. I just decided I'm just really struggling with how to offer my services to individuals who may not be able to afford it right now, given the circumstances. And so I had this free session. I said it was going to be 30 minutes. It went on for about 45 minutes. We had a few people register, and all of them were people who were actively caring for family members. And it was amazing. And there were some common themes that came up during that Q&A that I wanted to talk about with those of you who may be caring actively for family members, or you may have, family members who someone else is caring for. And, this applies, this doesn't mean that whether they're in your house or, you're a caregiver if you do anything at all to support a family member. Okay. So we've talked about this before, but, now in the face of coronavirus, everyone is a remote caregiver. Prior to this, there were many people. I've had many clients who were remote caregivers, meaning long distance caregivers. So the person that they care for may be, miles and miles away, and they're coordinating their medical care and, having to do things remotely. Well, now all of us are having to do things remotely because there's no visitation policies in the nursing homes, the assisted living facilities, the senior living communities, and the hospitals. Hi, Betty. Thank you for tuning in. So this is really important. And so, how do you effectively advocate for your loved one when you can't be there? It's a very, very sad situation. And I've gotten so many phone calls and so many emails from people who are just struggling, trying to figure out the best way to navigate these times. So I do want to share a couple of tips. One of the participants on my Q&A call a few days ago talked about the fact that his mom is in a nursing facility and he has had significant difficulty communicating. So I have heard the best of the best stories and the worst of the worst stories. Most of what I'm hearing is that The staff in the nursing facilities are really stepping up to the plate. Some of them are using their own personal cell phones, so that they can FaceTime with family members. Many of them have gotten shipments of iPads and other technology to allow the staff to, facilitate at least seeing your loved ones. So you can lay eyes on them and talk to them and make sure that they're okay. But this particular person that was on the live Q&A call said that unfortunately he has gotten a lot of resistance. He's gotten he leaves messages, nobody calls him back. He calls and nobody answers the phone. And so he was at his wit's end trying to figure out how to rectify that situation. And so I'm going to share with you all what I shared with him. And this is important, even when coronavirus is over. Anytime you are caring for a loved one, and particularly if you cannot be there in person, you have to be that squeaky wheel. And I'm not saying that you need to be rude. And he actually brought that up. I don't want to, if I feel like if I push too hard, they may mistreat, my mom. And I hear that a lot as well from clients. But, there's a way to be firm, but also polite. And, I feel for him because during this time when we know that caregivers are separated from their loved ones, to hear that, nurses, he said, were acting like they didn't really feel like talking to him or like he was bugging them, that just breaks my heart. But my advice to you is to be persistent, to be a strong advocate, to be the squeaky wheel, to always be polite, but to make sure that you are persistent. And what I shared with him and what I'll share with you all tonight is that everybody has a boss. So I don't know about you all, but when I make these customer service calls, which drive me up a wall, okay, like nothing bothers me more than being on a phone call with customer service. And it's not because the customer service agents, it's not always the customer service agents themselves, but it's just the process and just, it's often, I feel like, a waste of time. And so I have gotten really good at just cutting through all of that and let me speak to your supervisor. Hey, Ruby, thanks for tuning in. So we need to do the same things when it comes to our loved ones. So what I encourage him to do is, if the texts are not responding to you appropriately, then you need to call and ask for their boss. So every nursing home rehab facility has a director. Every unit, every ward has a nursing director who is in charge of that unit. And so I talk with him about how to call and get in touch with the nursing director. In my experience, personally and professionally, that person is usually really good. They are trained to handle complaints and things of that nature. And usually they will go to the source and, improve the situation between the resident or the family members and the nursing staff. So again, everybody has a boss. If that person doesn't respond appropriately, there is a director of the entire nursing facility. And so that would be your next step. If that person is acting like they don't have sense, then every nursing facility has an ombudsman. OMBUDSMAN, ombudsman. That person's role literally is to handle complaints and concerns. And they have an obligation legally to do that. And so you can always reach out to the ombudsman. You can go to the facility's website to find out who that person is. You can probably Google it to find out who that person is. And then, if that person isn't giving you the answers that you need, then remember that, these nursing homes and rehab facilities are regulated by the state. And so there are regulatory agencies in each state that oversee nursing facilities. And so you can file formal complaints through that route. So never feel like you are helpless. Never feel like you don't have the power to advocate for your family member. And now more than ever, because you can't physically be in that room with them, you have to use all of the other avenues to make sure that they are receiving the care that they need. Now, I had another caller whose spouse has dementia, and he was saying that the facility where she is, they've actually tried to use technology, but because of her underlying dementia, she just really wasn't responsive to it, and it was not effective. And so his question was, how can I get past that? What are some other ways? So we strategized about, ways that his wife has responded in the past. I know from personal and professional experience that a lot of people with dementia respond very well to music. So we talked about maybe him playing some of her favorite songs while they're trying to do FaceTime to engage her, to kind of provide that level of connection so she's just not looking at a screen. And just some other tactics, showing photos of places where they visited, happy times, things that she has responded to in the past. So we're going to have to be really creative. Those of you who are caring for family members right now, you're going to have to be really creative to maintain that connection. And of course, you can still make regular phone calls and things like that. But these are very trying times for the family members and for those of us who are caregivers. And so do whatever you can to maintain contact, engage the staff so that they can help you with that. I also advise this gentleman that, nursing facilities and rehab facilities have activities directors, and those people are trained to manage dementia, and they often are very familiar with other tactics and techniques to engage patients who have dementia. And so I suggested that he reach out to the activities director at his wife's facility and get him or her to, help him figure out how to connect with his wife during the time that he's unable to visit. So those are just a few tips. But, again, you have to be vigilant. Be a friend to the nursing staff. And I always like saying things like, whenever I'm about to have a confrontational or potentially confrontational conversation with another healthcare professional, on behalf of a family member, I always start it with some type of statement that acknowledges their truth. And so right now we know that the healthcare providers are stressed to the max, okay? They're not only worried about taking care of the patients, they're worried about becoming ill themselves. They're worried about bringing this home to their family members. And so I always start out with, I can't even imagine how difficult this is for you. You are probably tired, stressed, afraid. My heart goes out to you. And then go to your concern. I know this must be really hard for you, but I was hoping I could talk with you about my mom, my dad, my grandma. I'm really concerned. I've been having difficulty connecting with you all and getting up-to-date information. And I'm really, what can I do? What can we do to better connect? How can we improve our communication and our relationship so that I can be more in touch with my mom, my family member, and so that I can help you take better care of my mom. So I think that always helps. If you go at them with an antagonistic attitude or that's never going to work well, especially now when they are under so much stress. So we've all heard that saying, you get more, what is it, you get more bees with honey or flies with honey, more flies with honey. So put on the honey, and even though you're frustrated, acknowledge that they are also dealing with a lot right now. Hi Ronell, thank you for watching. I'm trying to see if there's anything else. I think that's it. If you all have missed any of the previous episodes, because we've talked about, last week we talked about what to do if, someone in your home gets sick and how to self-quarantine and if the person you're caring for is sick. So if you need information about that, feel free to go back and check out that episode. All of these episodes are uploaded to my YouTube channel. I will drop the link in the comments. But you can go to my YouTube channel and see all of these episodes in the month of March that have been fully dedicated to coronavirus. And now I really want to open it up to questions. So if you all have any questions at all, we can spend these last few minutes addressing those. The last couple of weeks I was using a different platform, so I couldn't really see your comments. So I addressed the questions afterwards, but I would love to address your questions live. If you have any comments, if any of you are caring for family members right now and you have comments, things you want to share about your experience, please feel free to drop those in the comment section as well. I know that there's a little bit of a delay, so I'll keep talking for just a couple of moments. And if I probably am going to do another complimentary Q&A session. It was so helpful. And so stay tuned to my Facebook page for information about that. And if you are on my email list, you will automatically get updates about when I do these special offers and when I do special calls and things of that nature. If you're not on my email list, you should be. And I will drop the link to that as well at the end of the broadcast. So I don't see any questions. Hi, Carla, Dr. Carla, and hey, Jackie. Thank you both for tuning in. Thanks to all of you who are watching. Thanks again to those of you who are going to catch this on the replay. If there aren't any questions, you all, then I'm going to go ahead and wrap up. I will come back. I always come back and address your questions and comments. So if you're shy about doing it while we're live, you can go ahead and drop it in after we're done, and I will address those. So again, this is Navigator Nuggets. Usually we air every Monday night, not Tuesday, Monday nights at 8 o'clock p.m. Eastern Standard Time, right here on this Facebook page. And I am your host, Dr. Nicole Rochester, board certified pediatrician, former caregiver, independent health advocate, and the CEO of Your GPS Doc. I help family caregivers do 3 things: relieve overwhelm. God, you guys, I just drew a blank. Relieve overwhelm, buy back their time, and ensure that their family members receive appropriate and effective health care. All right, you all, thanks again for watching. Please share this video with anybody and everybody in your circle who is caring for a loved one, whether near or far, and who can benefit from this information. I'll see you all next Monday for the next episode of Navigator Nuggets. Please stay safe. Please stay home. Please pray for our country. Pray for our healthcare workers, and for everyone else, the grocery store workers, the people who are delivering food, everyone who is, continuing to go to work every day so that we can enjoy the pleasures, even though under these circumstances. All right, you all take care. Good night.